Okay, I had a patient cancel their appointment. They moved it, so I thought I'd give you guys a little bit of a lesson on diagnostics here. And it's raining outside, you can see. It's raining a lot. So I wanted to go over cholesterol tests. Let's see if that works. Oh, it does work. Cool. Oops. All right, we're good. Okay, so, wow, that's really bad. I wanted to give you guys an accurate view of cholesterol markers. So typically when people go to their doctor's visit, they'll get a standard lipid profile, and it'll say total cholesterol, LDL, HDL. Typically they call the LDL bad cholesterol, right? And they call the good cholesterol HDL. And they think high cholesterol is bad, and they have to get it down with a statin drug, and millions of people are on these statin drugs, and we know now that these drugs are vastly overprescribed, and they're linked to increased risk of diabetes, of dementia, and muscle pain, erectile dysfunction in men. They have lots of side effects. So a lot of people don't know they can go to their doctor and ask and request for what's called a nuclear magnetic resonance test, an NMR test, or a VAP test. And these are two, I would say, better predictive tests to know your risk factors for heart attack and stroke risks. So here's a patient of mine's lab. I'll cover their name up. This is an actual, what's called a cardio IQ lab, and it's going to look at what's called the subfractionation of your lipid particles. So cholesterol, we know this very clearly in the medical literature, is that cholesterol doesn't cause heart attack and stroke. It's the oxidation or the inflammation of the particles that carry cholesterol that's the problem, not cholesterol inherently, which there's no good such a thing as a good or bad cholesterol. So here we have to look at the oxidation of the particles. So LDL, which they'll label as bad cholesterol, we know there's small dense LDL particles or large buoyant LDL particles, and the small dense LDL particles are like little rusted, oxidized, inflamed, like BB bullets, and those things can bounce around and tear through arterial walls, causing heart attack and stroke and cardiovascular problems. But the large buoyant LDL particles are like fluffy, buoyant cotton balls. They're not going to hurt you. So again, looking at just the total cholesterol or the LDL is a really inadequate view of cardiovascular health. You want to look at how much small dense LDL particles you have, and the NMR test or the VAP test are the only two tests that are out there in as far as diagnostic medicine that do that type of testing. And then other good predictors for heart attack and stroke beyond just the subfractionation of the lipid particles is going to be going to look at low HDL or high triglycerides. Those are two really good predictive tests to kind of see what your heart attack and stroke risks are. And again, your doctor can run these. They typically won't, because it's not going to change the treatment modality. You're going to get the statin drug if your cholesterol is above 200 regardless. So they're not really concerned at this sort of nuanced view of your heart health, which doesn't mean much if all you're giving out is statin drugs, but it means a lot for you as far as knowing your risk factors and knowing your baseline if you start making positive lifestyle interventions of where you need to go and where you need to kind of focus on. So I hope this was helpful. Again, that test is called the NMR, Nuclear Magnetic Resonance, or a VAP test. These are tests that we run on all of our patients around the world. We have patients here in Pittsburgh, and we have a virtual functional medicine practice for people outside of Pittsburgh via webcam and phone consults. So you can check out drwillcole.com, drwillcole.com, for more information on diagnostic testing like this. And I'll talk to you soon. I have a consult in about 5 minutes. Bye.